for joining us. This is the Mature Living Show, and I'm Mary Yanez, the director of the Senior Adult Program. And with us today, we have a mother-son team, a wonderful team that are the owners of the Tender Care Home Health Agency, and they are here to tell us about how they're making a difference in the community as they take their professional home care to your homes where you need it. And so with us is Ann Rodriguez McConnell. Did I say the right McConnell?
Yes, McConnell.
Okay. And of course your son, who is the community, the marketing and community relations person for Tender Care.
Correct.
And of course Adrian Rodriguez. Thank you for joining us.
Thanks for having us.
Thank you. There are so many home health care agencies in town. And there's a reason for that. And you were telling me earlier that there's so much need here in El Paso. How do you find the community as far as that's concerned?
Well, there's definitely a need. We have a growing senior community, and also patients now are getting discharged a lot quicker from the hospital.
Yes.
And so they require these type of services in the home.
Yes. And where do you find these? I know you've been around since 2006,
Right.
when you started the company.
Correct.
Give us a little bit about your background.
Well, I started as a nurse 30 years ago. I started in the hospitals, and I loved hospital nursing. Thought it was the best, until once I went into a patient's home, and I realized, wow, you can really make a difference if you teach them. And a lot of times it's just educating the patients on what to do, on how to take care of the medications, what side effects to look for, so it can keep them out of going back in the hospitals.
Yes.
We used to call them in the hospital frequent flyers, because they come back over and over again. But it could be prevented. A lot of it is just education.
It's wonderful. And so your services, what is it that you do? And we'll talk to Adrian a little bit about how he goes out and does his community outreach. But Ann, how do you care for your patients, and where do you serve them?
Well, right now we're serving in the El Paso area. Our service area goes all the way out to Fabens, from far northeast El Paso to all the way up to Vinton and West Way in that area. We also have opened a new agency in Santa Teresa, New Mexico, so we're able to go as far as to the Las Cruces area. So we're able to go a lot of the rural areas like Barreno, La Union.
Yes.
So all the way up to Las Cruces, Omesia.
And where do you find these elderly persons that need that home care? And we'll talk specifics about what does a home care provider do in the home.
Right. We usually get our patients from physicians. Our physicians will either recommend us upon hospital discharge, or maybe the patients have family members that are patients of ours already, because a lot of it's our word of mouth of our good care. But we get our patients from physicians. We have to have a physician referral.
And that's probably Adrian's area there, where he goes out and does outreach.
Right.
What is your role with the company?
Essentially what I do is I'm able to go and meet with the different physicians, explain to them our services, tell them what sets us apart from the other different agencies. They're all good agencies, but what makes us different? Why would they want to choose us as part of their home care regime? On top of that, I also work with the different community outreach programs.
And they might be Area Agency on Aging, or what other agencies
The
are
El
you
Paso
close?
Diabetes Association. We have done work with the Alzheimer's Association, the Kidney Foundation. On top of that, we're currently going to be part of the Be a Santa to a Senior program for the upcoming winter months.
This is a very important thing that happens in the home. What might a normal day for a home care provider, what might they do in the home for the patient?
We have skilled services.
Okay.
We are nurses, registered nurses, licensed vocational nurses. Usually the registered nurse will go out and do an initial assessment.
Yes.
And they will evaluate the patients physically, and then they'll also assess the home situation and see if there's any equipment that might be needed. We'll also make a recommendation if the patient might benefit from some physical therapy, if they're unsteady, or if they're holding onto furniture or walls when they're walking, or also maybe if they're having difficulties with their, maybe putting on their clothes or putting on their shoes, we might ask for the occupational therapist. Sometimes if patients are maybe forgetful, or they're starting to get increasingly where they maybe not are taking their medications, we'll even ask for speech therapy, for cognitive training. So we use a lot of our therapists, and to be able to, assess our patients and to give them what they need.
Okay, wonderful. One of the things that people think about is cost. How are these services being paid for? How do you qualify?
Right. We're a Medicare certified agency. We're also accredited through ACHC in our Santa Teresa, New Mexico office, which is a hospital corporation accreditation. We are paid really by Medicare. Medicare usually reimburses us almost at 100%. I mean, if the patient is requiring any type of equipment, then they're responsible for their 20% copay if it's any durable medical equipment. But other than that, these services are reimbursed by their insurance.
Wonderful. Adrian, anything you want to add to our audience here that are watching and listening to us attentively? Who might they know that needs this kind of care? This kind of service.
Pardon me, the question again?
Yes, as our listeners are watching, who might need this kind of care?
The kind of person who could use home health is a person who is, by Medicare definition, has a taxing effort to leave the home in order to go receive care at a physician's office or an outpatient facility. That kind of person is the kind that we can go into the home and actually do these services for them.
And are your employees bonded, and are they?
We're screened.
They worry about
background checks.
We do extensive background checks. Even in our New Mexico office, they actually require FBI fingerprinting testing. So we actually have to go. Everybody has to be screened on certain levels before we can hire them.
At times, Mary, that could be a complication with our agency where patients refuse services because they just aren't aware of what we offer. They don't feel safe knowing that someone's going into the home, and we're here on the show to tell you that they should feel safe. They are fully screened, background checks, and we do hire based on the caring ability. Alongside with their nursing skills. We hire the nurses who do care, who do want to give back to the community and actually take care of these wonderful
isn't that
patients
wonderful?
we have.
That's what it's all about. It really is.
I
And
love
that's
that
what we went
word,
into school
tender
for.
care, because that's what my mom got, from her providers, and it's true.
It's that special touch you give them to know that, yes, it does make a difference. I mean, for someone to want to improve themselves, they have to buy into it. When you're having to tell them, okay, you have to monitor your diet, or you have to do, take your medications, they have to realize why. And the complications if they don't do it, what's going to end up happening. And then they'll say, okay, well, then
They'll
maybe
end up
I should learn
frequent
it.
flyers back to the
If not, they'll
hospital.
be back in. And, you can't help everybody, but, I mean, if you really show that you care, it really makes a difference.
Wonderful. How can they reach you if they want you to talk about your services and to
They're more
make
than
a
welcome
choice?
to call the office. Our phone number is 915-581-3345, and that phone number works for both New Mexico and El Paso offices. You can call either that number to reach for New Mexico or El Paso patients.
And
or
if they
can
call, you always send somebody to interview or to make an assessment. Do they need a referral from the doctor
We need a referral
first?
from the doctor. What we would do is we would ask them, see if, maybe talk to them, screen them a little bit over the phone, see what type of services they're looking at, and then we would ask them to call their doctor, call their physician, and it's always patient's choice. I mean, it's always their choice. They can choose which home health agency they would like. But, so they can ask for this agency if they would like, from their physician.
Well, I'm sure that if they talk to Adrian Rodriguez or they talk to Ann Rodriguez McConnell, who is the owner, we're so happy that you came by
Well,
to
thank you.
share
We
with us
appreciate you.
about your company, and I'm sure you're doing great work as many of the other dedicated health professionals are.
Well, thank you.
Thank you for coming
I'd like
over
to thank
here.
you so much,
One
ma'am.
more
Yes,
with the passion you see coming from Ann, that passion flows into all of our nurses, into all of our staff. We were greatly rewarded with being top 500 in the nation as far as home health agencies are concerned.
In 2008.
There's close
yes.
to over 8,000 home health agencies in the
Wow.
United States.
That's a
We're in
very
the
good
top
honor.
6%.
that is
So
so
we
good.
awarded that,
And
and I
you're-
wanted to make sure we mentioned that.
Well, I'm glad you did, and that's a great way to end this wonderful interview.
Well, thank you so much. I
With the
appreciate
good
your time.
news. All right.
Thank you.
We'll be back with more Mature Living.